Hi, welcome back to Surgical Scrubology. My name is Damon. I'm a surgical technologist certified. And the topic of today's video, certifications. There are a few certifying bodies in the US, but we're going to talk about two. That's the NBSTSA certification, or the National Board of Surgical Technology and Surgical Assisting, which allows for the use of the title Certified Surgical Technologist, or CST for short. Certification typically requires completing an accredited formal education program or military training program and passing an exam. The second is the NCCT certification, or the National Center for Competency Testing, which allows for the title of Tech and Surgery Certified, or TSC for short. Applicants may qualify through formal education, military training, work experience, all requiring documenting critical skills and then passing an exam. But before we go any further into this video, please hit the subscribe button, hit the like button, and the notification bell so you don't miss any of my future content. And with that being said, let's cue the intro. To obtain certification through NCCT, or the National Center for Competency Testing, there are three main routes of eligibility to take the exam. The first is a two-part. A, you are a current student in a surgical technology program. You must be a United States high school graduate or hold the equivalent credentials, GED. You must submit a copy of your surgical technology diploma, certificate of completion, or a transcript with graduation date within 60 days of graduation, or contact NCCT for other suitable arrangements. You must complete and submit a Tech and Surgery Certified Critical Skills Competency Form. Candidates are allowed a maximum of 2 years from the test date for completion of case documentations. These documents are not required to take the exam, but your certification will not be released until they are received. Part B, you are a graduate of a surgical technology program. You must be a United States high school graduate or hold the credentials, GED. You must also submit a copy of your surgical technology diploma, certificate of completion, or transcript with an official graduation date. And you also must complete and submit a Tech and Surgery Certified Critical Skills Competency Form. Candidates are also allowed a maximum of 2 years from the test date for completion of case documentation. Route 2, experience. You must submit a copy of your high school diploma or equivalent and a Tech and Surgery Certified Qualifications by Experience form completed by your employer. You must have 3 years of full-time employment or the equivalent, 6,240 hours, in the past 5 years as a surgical technologist under the direct supervision of a certified licensed physician, primary care provider, and/or a RN. Route 3. You must be a United States high school graduate or hold the equivalent credentials, GED. You must provide a copy of your SMART transcript or a DD-214 indicating you have successfully completed a formal medical service training program of the United States Armed Forces related to the discipline for which you are testing. The DD-214 or SMART transcript must be current within the past 5 years. You must complete and submit a Tech and Surgery Certified Critical Skills Competency Form. To obtain certification through the NBSTSA, one had to be a graduate of a surgical technology program which was CAAHEP accredited during their enrollment, and then have one of the following: a notarized letter or institutional letterhead from the program director which states your name, date of graduation, and type of degree awarded. and then have a copy of your graduation certificate or transcript. Transcripts don't have to be official, but the NBSTSA reserves the right to order or request an official transcript. Next, you can be a graduate of a military training program in surgical technology before, during, or after having a CAAHEP accreditation, and then having one of the following: a copy of your DD-214, which must state the location of the base where the program was completed, and then have a copy of your graduation certificate from the surgical technology training program or a SMART transcript. And finally, if you have on-the-job training in the surgical technology or are a graduate from a surgical technology program that did not have a CAAHEP accreditation during your enrollment, the Accelerated Alternative Delivery, or AAD pathway, will take into account the previous education and experience you have to determine which classes you must take to meet the requirements of a CAAHEP accreditation program. Distance learning options are available. Upon graduation from an AAD program, you will have a degree that makes you eligible to sit for the CST exam. Let's talk a little bit about the benefits of holding a certification. To have a certification credential means that you are the best in your career field at what you do. When you come into the room with other technologists, there's some that graduated, some with experience, but you have the credentials of CST or TSC. And what that says is that, hey, I took the time to study, to work hard, and to sit for exam, to have these credentials to say that I'm the best or I'm very competent in what I do. Secondly, you have many more career opportunities. Just think of it like this. If there are two people with similar resumes that an employer is looking at, both of them have similar experiences, but one has the certification and the other doesn't. I don't know about you, but me as an employer, I would definitely pick the one with the certified credential to interview first. And lastly, increased income. It's been my experience when I got out of school, holding the credential CST always got me in the door to places, not necessarily more income, because I believe your skill set or your experience level will decide your income ultimately, but it doesn't hurt to actually have the CST credential or be certified in your field. There quite possibly may be some starting salary benefits associated with that, but from my experience, increased income doesn't necessarily solely come from having the credentials, tech and surgery certified or certified surgical technologist.